The CBO and the Joint Committee on Taxation estimate that in 2018, 14 million more people would be uninsured under the legislation that is more than under current law. Do you agree with that?
I agree that 11 million of them, freed from Obamacare mandates, will choose not to buy health care they don't want and can't afford.
The increase in continuing on from CBO, the increase in the number of uninsured people relative to the number under current law would reach 21 million in 2020, 24 million in 2026, and in 2026, an estimated 52 million people under age 65 would be uninsured, compared with 28 million who would lack insurance that year under current law. That's from Keith Hall, the director of CBO. Do you agree in part? Do you think any part of that is a fact? Mr. Walden?
Well, if I could just respond to two things, and I will respond directly to your question because, no, I don't agree. But the is the insinuation that we don't care about people on Medicaid. I'm offended by that. I reject that. Mm-hmm. And I think because the member does not know my history in terms of working on this issue in Oregon, when I became majority leader, I created a select committee, bipartisan, to implement and expand Medicaid coverage and help for those in the low income. It's called the Oregon Health Plan. It had been passed before, and we expanded it. I've worked on these issues to expand access to care in a rural district.
So Greg, then tell me about the $800 billion that's being taken out of Medicaid, when in fact all we had to do was leave the taxes that are here for very wealthy people. 400 people are receiving a substantial increase in their taxes.
I know.
They desperately don't need it. Do you not see how that affects Medicaid?
Okay, I'm going to try and bring the tone down here just a little bit.
I'm not going to bring my tone down. I'm mad as hell about what you all are doing, and I don't have to be nice to nobody when you're being nasty to poor people.
Well, let's take this one at a time, because you asked me about the CBO.